Hey everybody, Dr. G here. I'm a licensed clinical psychologist and body language expert, and today we're going to be analyzing parts of the Take Care of Maya trial. Maya Kowalski and her family are suing Johns Hopkins All Children's Hospital for over $200 million for a wide variety of allegations, including essentially medical kidnapping. What we're going to be looking at today is testimony provided by various individuals involved in the case. What we're not doing is trying to discuss whether or not this case does or does not have merit. I'm also not providing any sort of diagnosis or doing any type of psychological evaluation. Before we get started, though, I do want to remind you to like and subscribe if you want to see more content just like this. All right, let's go. Today, we're going to be looking at testimony by licensed clinical social worker Catherine Beatty, as well as Dr. Sally Smith. The analysis today is really going to look at two different aspects of the testimony. One is that I'm going to be providing feedback based on my own experiences. I've done hundreds of parental fitness evaluations, many referred by the state. And to understand what a parental fitness evaluation is, it basically assesses whether or not a parent is fit to care for their child, and that was a big question in this. In addition, I'll be talking about how a jury might perceive these individuals. So this is a bit different than the body language analysis, the behavioral analyses I oftentimes do. What I'm talking about today is how a jury might perceive these individuals based on the way that they're reacting and responding to questions. All right, let's just jump right in.
I want to know a little bit about your qualifications for a case that I think you would agree with me is this complex. Would you agree with me this is a complex case?
Yes, I would agree with you.
Tell me what, before being assigned to Maya, what specific training you had in CRPS?
I didn't have any in CRPS.
What is RSD?
It's regional pain disorder.
This may sound obvious, but she's answering these questions directly, which juries like. And I think that's an important thing to keep in mind based on what we're going to be seeing as we continue to go. So I just wanted to go ahead and point that out.
Okay.
I had to think about it.
All right. How about, do you have any specific training in RSD?
No.
How about Munchausen's by proxy?
Yes, in graduate school.
Okay, and what was that specific training that you had in graduate school?
Psychopathology.
So when the attorney asked what specific training she had, and she's saying she took a psychopathology course, I would probably answer that differently as it applies to me. Now, I have had some training in Munchausen by proxy because I was supervised by someone who had some specialty in that area. When you go to graduate school and you have a course and there's maybe a chapter on it or a couple of pages on something, I don't know if I would consider that training specifically in Munchausen by proxy. That would be training in psychopathology, but I think I interpret this question a little bit differently than she did.
And how long would you say they spent on Munchausen by proxy?
I can't tell you, that was a long time ago.
So this is where juries are not going to like how she's answering this question. When people are vague or when it seems like they can't answer a question, then it starts to seem evasive. If she got the training then, and she's supposed to remember what she was trained in, you would think she would be able to give you some estimation of how long it was.
As if any of Munchausen's by proxy, where it was confirmed it was Munchausen by proxy, had you handled?
3.
All right. 3 cases?
Mm-hmm.
So there are questions that I think the attorney should have asked here, because in my experience, these are the questions that get asked of me, which is, am I the one that provided the diagnosis? Were there other people involved? What was my level of involvement in those 3 cases? Because just saying that she was involved in 3 cases, that could mean many different levels of care. So I don't know, did she provide that diagnosis or whatever it was? I want to know more.
Well, did you read things about it or study anything about it? Okay, what did you read and study?
So through graduate school, I read many of articles that were written in the medical literature, along with the social work literature.
Specific to Munchausen by proxy?
Yes.
Okay.
So if I had answered the question in that way, I feel like an attorney would be like a dog with a bone. That if I had said that I don't have expertise in Munchausen by proxy, but in grad school I read a bunch of articles specific to it, I feel like they would have a lot of follow-up questions about that.
So then, are you telling us you had sufficient knowledge to determine whether a specific action, inaction, or behavior was consistent with Munchausen by proxy?
That's not my role at the hospital.
So once again, this is the way that juries do not like people to answer questions. He asked a direct question, and rather than just saying no, she said, that's not my role at the hospital. Now, they may mean the same things, but juries like definitive answers. If she had said, no, that's not my role in the hospital, that's different than just saying, that's not my role at the hospital.
Did this child's operating diagnosis include complex regional pain syndrome?
Her diagnosis included that, yes.
So here's one of the things that is also complicated when it comes to those of us in mental health, is that if a physician who is licensed provides a diagnosis, we don't have the authority to challenge it, really. If there's somebody who you think is truly acting in bad faith, if you think that there is a physician who is literally being abusive or trying to harm someone, that's a little bit different. But generally speaking, if someone provides a diagnosis, we're not qualified to push against a physical diagnosis unless it's specifically related to mental health. Nobody cares what we have to say about it, nor should they.
And on multiple occasions, you made recommendations to limit the child's contact with certain family members, including the father, did you not?
Yes.
All of the things you were doing were based on a presumption that there was Munchausen by proxy going on with this family, right?
Not my presumption. We had been sheltered, and I had to follow the shelter order along with the visitation orders that were given by the court.
And this is true, but the challenge is the court makes their decisions based typically on what professionals have determined. So if I did a psychological evaluation that said this parent is not fit to parent their child, they're just not capable of it, the court would take that into consideration and make their determination partially based on what I have to say. The judge is going to base their determination on what professionals have provided. So this is this sort of circular logic. She's saying she followed the shelter order, but the question is, who provided the information that would cause there to be a shelter order?
Okay, who else in the hospital, after reviewing all of these emails and memos we're about to go over, who else had day-to-day control over who Maya could see and not see, and who could come in at what time and not come in at what time? What other person?
That was up to the court order.
So this becomes that circular argument again, which is, well, the court order said this is what we had to do, but the court order was based on recommendations by professionals. So it becomes this circle of whose fault it is or where blame lies as far as what choices were made.
Did it strike you, or does it strike you at any time, how serious it is to take a 9-year-old girl away from her family?
Well, yes, definitely.
How harmful that is to a child?
It can be.
So I'm not trying to split hairs here, but I'm talking about how a jury will see this, saying it can be when it comes to how harmful it is to separate a 9-year-old child from their family. It usually is. It almost always is. So saying it can be sounds like it's minimizing. Once again, I'm not saying she's trying to do that, but I'm letting you know how I think a jury will interpret this. A jury will not like hearing her phrase it that way. And that sounds like I'm splitting hairs here, but saying it can be versus yes, it is usually harmful to separate a child from their family and so on and so forth is a very different response.
I saw the mother on...
You heard what?
I heard and saw on numerous occasions the mother demanding from the doctors that the child be given amounts of ketamine. And I heard discussions from the doctors saying that that was too dangerous.
So as someone who has diagnosed Munchausen by proxy, I'm not saying that she's wrong necessarily, but I'll tell you in my experience, for example, when it came to providing that diagnosis, and I've had to answer questions like this, there was literal video footage that was backing up the claim saying the parent was, and I can't get into specifics, but I can say the parent was doing this, they were caught on video doing this. That is directly how we made that determination of Munchausen by proxy. The way that she's responding to this, talking about how the doctors are talking about the amounts of ketamine and the doctor saying it's too dangerous, this is probably not the strongest example to start with when talking about why the mother would have Munchausen by proxy.
Did you know at any of those times that there were multiple expert doctors who had actually prescribed that amount of ketamine?
I didn't know that.
Okay. Once again, and everybody's a little different with how they practice and their experience and the way that their organization is set up. In the cases I've been involved in related to Munchausen by proxy, Well, in pretty much every case, but really in those, you'll get a medical record that is literally like inches thick, and you got to evaluate that whole thing.
Early on, probably not.
Did you know Dr. Hannah was prescribing that?
Early on, probably not.
Okay, well, if it wasn't Jay...
This is so confusing to me how you wouldn't know that. Once again, I'm not trying to be critical. I'm just confused because that doesn't really make much sense to me.
And that somebody called DCF and complained that this was child abuse and that this child should be taken away from her mother, and that the people that said that were all Children's Hospital doctors, social workers, and nurses. You understand that, right?
Under Florida statute, we have the responsibility to report all suspected child abuse.
So once again, see, that was not a response to the question. So if we go back and look, she says Johns Hopkins didn't take this child away from her parents. And then he points out that it's all Johns Hopkins nurses and doctors that called the child abuse hotline and reported it to DCF, who then went to a judge that made that determination. In essence, these were determinations based on information provided by people who work at all children's hospitals. So once again, juries aren't stupid. When they hear all of this, it's going to seem like she is not being direct. I'm not saying that she's not trying to be direct, that she may be answering the questions to the best of her ability, and it just sounds this way. But I don't think juries are going to like this because they are going to feel like something is deceptive about this.
When we look at pain and when I see kids in pain, Maya was never showed some of the symptoms that we see other kids in pain.
All right, so they're asking about Maya's pain. It sounds like she's suggesting that Maya's pain is different than other children's pain. I don't know if that means that she doesn't actually believe that Maya was experiencing pain or if she thinks that she was feigning. But if that was indeed what the belief was, for me, as a psychologist, the follow-up would be, let's find some way to determine whether or not this child is malingering. So malingering basically means faking bad. So if you do a test of malingering, you can see whether or not they're lying or faking bad on that, because those things can determine with absolute accuracy whether or not somebody's lying. And if they're lying about that, that might mean they're lying about other things. Not necessarily, but as you're trying to build this hypothesis, it gives you data to work on rather than just, well, her pain was different than other people's pain.
Pain syndrome is a little different than having a broken leg, is it not?
Oh, yes.
Complex regional pain syndrome involves a burning sensation under the skin, right? It's quite painful, is it not?
I've never had it.
Okay. Now, the way that she's responding to that, once again, I'm talking a lot about how juries would respond to it. They really are not going to like that response. So when someone asks you if CRPS causes pain, I think any of us can say, based on what we know about it, yes, it is a pain disorder. And if you've seen somebody with it, yes, it causes pain. But her response is, I've never had it. Let's go back and listen to this part again, because I do think that these are the parts that juries are going to remember and things that don't play very well with them.
Right? It's quite painful, is it not?
I've never had it.
Well,
if somebody asked me, does breaking your leg hurt? I would say, yes, I presume it hurts. Not, well, I've never broken a leg, so I wouldn't know. It's a fair assumption. So when you won't answer something that's very direct and a very fair assumption to say, I've never had it, is an odd way to respond, if I'm being frank.
Right? It's quite painful, is it not?
I've never had it.
Well, have you read anything on it?
I have read something on it.
Okay. So, Maya's symptoms of pain were consistent with patients who have complex regional pain syndrome, were they not?
Again. I'm sorry, I'm shaking my head. Yes.
They were, right?
Yes.
Sorry. Okay.
This was a very strange interaction. To be completely honest, it flummoxes me a little bit. It's just peculiar.
First, sit Maya on your lap.
And whenever they had the last court hearing, maybe it was right before Christmas, and Maya thought she was going home. I was called by Charlotte to tell, and Charlotte asked me to go in and tell Maya that Maya wasn't going to be able to be going home for Christmas. Maya became very upset, started crying.
I'm just asking you whether you put Maya on your lap.
She asked then to sit.
So something like this is very complicated. The idea of making contact with a child, letting them sit on your lap, is always a bad idea. Now, I'm not saying this specific to her. I'm saying this to anybody who's a licensed clinical social worker, psychologist, psychiatrist, anybody. This is a bad idea for a multitude of reasons.
So you're contending that this wasn't your idea, that it was Maya's idea that she sit on your lap. Is that your testimony?
Yes.
All right. And did you kiss Maya?
I don't think so.
Were you hugging Maya?
And saying I don't think so rather than no leaves open the possibility that that might be within the wheelhouse of behaviors that she might engage in. Now let's move on to Dr. Sally Smith's testimony. So now we're going to watch some testimony provided by Dr. Sally Smith. She was the head of the child protection team.
Pediatric psychiatry.
No, I do not.
Would you agree with me then that you do not hold yourself out as an expert in pediatric psychology?
I do not.
Would you agree with me then that you do not hold yourself out as an expert in...
So there's part of this testimony that genuinely confuses me. And if anybody else has any feedback about this, please let me know. We're going to watch this and I'll explain what's confusing.
Agree with me then that you do not hold yourself out as an expert in pediatric psychiatry?
No, I do not.
So he's asking, would you agree with me that you are not this? She says, no, I do not. So it's confusing as to whether or not she's saying that she does not agree with him or no, she's not an expert in that area. I'm going to let it continue to play and I'll show you why it's really confusing at the end.
Would you agree with me then that you do not hold yourself out as an expert in pediatric psychology?
I do not.
Would you agree with me then that you do not hold yourself out as an expert in pediatric neurology?
No.
I mean, you're agreeing with me.
I do not.
You're agreeing with me, right? She says, I do not. I'm very confused as to where we landed at the end, whether or not she believes she is all of those things or she's not all of those things. Anyway, I just wanted to throw that out there.
Dr. Wassenauer, is that
Yes.
right? He did not receive records from Dr. Chopra. Is that right?
Not to my knowledge.
Or Dr. Cantu?
I was never able to obtain records from Dr. Cantu.
All right, so as far as how a jury is going to react to this, I have a couple of reactions myself. One is that she's answering questions right here very directly. Once again, people like that. Even if you're reporting something that you don't feel is entirely favorable, answering directly is always the best option for a jury because they will see you as being truthful and straightforward if you respond that way. One of the challenges I think that she may have is that she is being accused of making choices that are not in the best interest of Maya. Whether or not that is true is immaterial. That is not what I am here to do today to determine that. That's up to a jury to figure out. Now, one of the challenges I think for her in this situation is how she presents, and I'll explain what I mean by that. So she's very direct, very blunt. She has a very firm way of speaking. And if she is on the side of a child and protecting them, people are going to go, I like her because she is able to protect this kid. However, she's being accused of making decisions that, according to Maya Kowalski and her family, were not in the best interest of her or her family. And so presenting this way when there is someone who is claiming to be a victim can work the opposite way. It can backfire. It can make people seem callous or cold. I'm not saying that Dr. Smith is those things, but she may come across that way because of the manner that she speaks and the directness that she speaks.
So I don't have them and did not have them to provide to him.
And so you are familiar with the fact that Doctors Hannah, Kirkpatrick, Barr, and Wassenauer all diagnosed or concurred with a diagnosis of complex regional pain syndrome, right?
That appears to be correct.
Now, you'll notice they edit these videos down, and I think that they showed that for a reason. Because if you asked me that question when I'm providing testimony on an evaluation that I've done, I'm 99% sure I would know that. And so the idea that she had to look this up, or the idea that she spent time looking it up, I think is something they wanted the jury to see, actually, because they think that it's relevant that she had to look up to agree with these things. Maybe not. Maybe that's just what they wanted to show. But they really could have abridged that to her just saying, yes, that appears to be correct, like they seem to do for many other clips.
Okay. Did you have a conversation with Dr. Kirkpatrick in which he told you not to move forward with Munchausen by proxy or another allegation of child abuse?
I do recall that he made some such recommendation to me. I don't recall the exact words.
Did he express to you that there was an organic basis for this child's pain?
So this is interesting. When you have another licensed practicing professional who gives you recommendations, you don't necessarily have to agree with them. But I think it makes a much more complex situation when you have another physician that has specifically made these requests.
Table 6.2, the last bullet point, recommendations for confirming factitious disorder by proxy, consider covert video surveillance.
Now, that's not that unusual. When it comes to something like factitious disorder by proxy or Munchausen syndrome by proxy, same thing, which basically means that a parent is making the child sick. That's the idea. And oftentimes they do that by actively making the child sick, injecting them with something, giving them something that makes them ill. There's all sorts of ways that you can catch them in that. So it's not really unusual for somebody to use video, covert video, to catch somebody with this kind of thing.
Did you, in fact, consider covert video surveillance?
There was, I believe, there was a day or so that there was some videotaping of the child in her hospital room in an attempt to.
All right, now this is very different than what I'm talking about. Typically, it would be used for the parent. The parent is the one with factitious disorder imposed on another, I think is the full title, or Munchausen by proxy. So what we would want to do is catch the parent doing something.
There were numerous instances during the video which were comparable to numerous observations of the physical therapist, the nurses, the child life staff, the music therapy staff, etc., of the child moving around in bed, putting her feet in normal neutral position.
But here's the challenge, is that if you're trying to prove that the parent is the one causing this, if you're trying to suggest that the mother was the one that was causing this for the child, I get you're saying there'd be benefits to show that she can actually move around more than she says, whatever. But that's a different issue. What you would need to see is the mother telling the child, hey, stop that, or the mother doing something, the mother enacting something that would cause the child to react in that way. So to me, this is actually monumentally less relevant than if they caught the mother doing something.
Several treating physicians at points along the way while she was admitted.
All right, let's look at...
Juries also don't love stuff like this.
With several treating physicians at points along the way while she was admitted.
All right, let's look at what we'll mark as Exhibit 7.
Had very inconsistent patterns of movement and reports of pain in response to certain movements, and numerous other observations that were made by the hospital personnel. So this was...
So here's where it starts to get confusing, because it lasted so long. Is why is it that they didn't do more evaluations on Maya specifically as to whether or not she was faking it? I know Dr. Lewis did an evaluation. I don't think that was a component of it. Maybe he had his own judgment on it, but I don't think they literally did tests of malingering. Just like, as far as I'm aware, I don't think they did a parental fitness evaluation on the parents, which would have made perfectly logical sense in this case. If they did, there's so much information. Somebody please correct me if there is a literal parental fitness evaluation done on Beata or the father. But as far as I know, that was never done. And that can really help establish the parent's mindset, the type of beliefs the parent has. A parental fitness evaluation can have a component of it that's psychological, or it can just be measuring their attitudes towards parenting, possibly abusive attitudes, all of those types of things. So it's hard for me to understand why there were certain things that just weren't done, because they could have had very definitive information about all of this if they had just gotten a parental fitness evaluation.
Well, you never even told her that you were investigating her for allegations that she committed child abuse, did you?
Well, based on Mr. Hughes's report of her email, I think we could, have a discussion of what she understood about what I was doing. But
no, this is about you.
I introduced myself as a pediatrician with the child protection team. I did not go into major detail about what that meant.
So this is something that may be different with physicians. For a psychologist, we have to make sure that we've given them what we call informed consent. They have to know exactly why we are there. So sometimes, let's say somebody has a mandatory evaluation of some kind, a court-ordered evaluation. I would still be very clear about exactly why I'm evaluating somebody, because we hope that they're still going to tell the truth and that they'll go along with it. And if they refuse to do it, so be it. But we have to be very, very clear with what our role is, what we're doing, and what the assessment is for when we're interacting with patients.
And you did not do that with Jack Kowalski, did you? In that first interview with him, let me finish my question. In that first interview with him, you did not tell him that you were investigating him for possible allegations under allegations of child abuse of Maya, did you?
I introduced myself as with the child protection team. I did not go into detail about what that meant.
And once again, I'm not criticizing Dr. Smith because maybe that's typical for physicians, but that's very different than how I would approach something like this, because what is incredibly important is that people know why you're there. So if you're there to assess whether or not somebody's been abusive, I want people to know that's what I'm gathering information for, because it would be considered, for a psychologist at least, it would be considered deceptive not to make sure that is very, very clear.
And you did not tell Maya Kowalski in your version that you were investigating her parents for child abuse, did you?
I was taking a medical history from the people in terms of...
So once again, earlier, she was very, very clear in her yes and no responses, very concise. She is less clear in these responses, which once again, especially once you've set that tone with the jury, when you start responding this way, it's going to change how they see the information you're providing.
Instructing them about that I was an investigator or something. I did not do that.
I know this is a very complex case. There's so much testimony that I could go over. There's even more here that I could go over, but I'm trying to make this video relatively concise. But what we're observing is attorneys that seem to be challenging the possibility that they were able to establish that there was a parental fitness danger. And those are the kinds of things that can be very easily addressed. And I'm a bit confused as to why they weren't. And maybe that's just not standard for hospitals. It's been very standard in my case, but obviously I was the one doing the evaluations, so it's a very different case. What I don't understand is why they weren't pursuing more objective information from psychologists and elsewhere, specifically about whether or not people were malingering, whether or not they had parental fitness attitudes that were dangerous, all of these various aspects of the psychology. Obviously, I'm a psychologist, so this is what I want to know. That doesn't mean that they had to do those things, but I certainly would have, because I want to know more. Hopefully watching this is helping you better understand how some of these things work, and I also hope it's helping you understand how the jury may be reacting to the way that they respond. I think the way they provide information at times may be challenging for a jury, but we'll see. So if you have any additional thoughts or there's testimony you want to analyze, please let me know. Last thing before we get finished up is I do want to remind you to like and subscribe if you want to see more content just like this. All right, thanks for watching.